In this video, let us talk about professional secrecy, professional secret. Okay. Basically here you're not supposed to open the mouth. Correct? So this is what is professional secrecy. Earlier you have seen one thing called as privileged communication. That means you can talk about it when it's the duty to the patient's relatives or the patient, to the society, when you have to say, because everything you saw all this in the previous case. Here you have to open your mouth and talk, basically in privileged communication. In professional secret, you're supposed to keep the secret. So that is what is the difference. That much you have understood, right? Now let us move on to the introduction in professional secrecy. Professional secrecy is an important duty of the doctor towards his patient. It implies a contract between the doctor and his patient, according to which the doctor is obliged to keep secret any information about the patient and his private life, okay, which he learns in course of his examination, investigation and visiting the patient's house. Okay, disclosure of this information without the consent of the patient would be breach of the confidence and trust, and the doctor can be sued for damages. So it is better to keep the mouth shut on these aspects. We'll come to them. Now, examples. To relatives, what information you should give. Doctors should not answer any inquiry by a third party. Okay, sometimes even near relatives and wife, regarding the nature and prognosis of the illness without the consent of the patient. You have to take the consent of the patient. Okay. Even wife, they are saying you cannot say. Interesting. Basically, in the previous video you saw, if there is suicidal tendency or STD, you can say. But otherwise, you cannot say, right? Now, in case of minor or insane person, then it can be disclosed to parents or legal guardians. Okay. That you can add in the privileged communication only there. Okay. In divorces and nullity cases, no information can be given without consent of patient. So if it is a divorce and all, you cannot basically give any information of the patient without consent. Okay. Now, to sponsor of the treatment. Now, there is a guy who is sponsoring this treatment. He is paying for all this treatment. So to him, what you can say and what you can't say. Illness of a servant should not be disclosed to the master without the consent of the servant. Okay. Even though the master paid for the examination. Okay. But here, in privileged communication, what you saw that if a teacher has tuberculosis, or if a driver has color blindness or epilepsy or alcoholism or drug addiction, then you can tell the employer. Correct? And one more we saw, if a cook has some enteric disease, then you can inform the employer. But here, they're telling you where you should not talk. You should not talk even if the master is paying for the employer is paying for the employee's treatment. You're not supposed to disclose the treatment details to the employer. You cannot disclose this information of the parents without the patient's consent. Okay. Then, even sometimes treatments are free, right, in government setups, but you're not supposed to disclose the patient's information. Next, to government and authorities. Except in cases of notifiable diseases, the doctor should not disclose any fact about the illness of his patient, even to public. Okay, he is not supposed to say without the consent of the patient. Okay. So, if there is under trial in police custody, he has the right to professional secrecy. Okay, but if he is convicted, then he loses his right. If this guy is only under trial, then he has secrecy. Professional secrecy he can keep. But if he is convicted, then you are free to discuss his medical information. See, there is something here called as to government authorities or authorities, like insurance people can know your medical history. Okay, it's implied consent. So that will become more like instead of a professional secret, it will become more of a privileged communication kind of a thing. Okay, so you can inform them. Now coming to colleagues, to medical students. So if you are writing any medical journal or textbook, you need not, reveal the patient's identity, name, photograph, all that you should not do. Okay. I think we'll leave it at that. So this is professional secret. When to keep the mouth shut. Basically that's what it means. In privileged communication, you are at the liberty to inform. Okay. So that's all for now, guys, in professional secrecy. Let's just revise this. Information to relatives you should not give unless the patient is approving. Remember, but there are exceptions which you have seen in privileged communication, like suicidal tendencies, STDs, or if they are insane or if they are minors, then it can be given. Then coming to sponsor of treatment, you should not tell the employer even if he's paying for the employee's treatment. Okay, but you have to inform if the teacher has tuberculosis, if the cook has enteric disease, or if the driver has alcoholism, addiction, colorblindness, seizures, etc. So there are again exceptions there. Now to government authorities, notifiable diseases you have to tell. Okay, and then what else you should tell? Insurance policy you can tell. If there is crime, you have to tell. But you should not tell anything else like any other diseases and all, not required to tell. Okay. If there is an under trial, then his professional secrecy is maintained. But if he is convicted, then he loses the right of his secrecy. Now coming to whenever you are publishing any journal or textbook, etc., you should not disclose the patient's identity, name, photograph, etc. Okay. It's better to take the patient's permission also. Now coming to medico-legal importance of professional secret. Professional secrecy is very essential for a good doctor-patient relationship. Okay. So it's not only for the living, it also extends to the dead. So for dead people also we should maintain the secrecy. If it is not related and relevant, then probably you can keep something as a secret. So exceptions are there to this professional secret, and those are called as professional privileged communication. So the exceptions are called as privileged communication, which you have already seen. Okay, that's all for now, guys. So we are done with this topic, professional secrecy. Bye bye.